connect the right dots. So I don't know if you'd be familiar with hackathons. So the NHS run NHS Hack Days, where students are encouraged to come along with current clinicians, GPs, consultants, patients, and also startups and computer scientists to develop apps and tools to improve healthcare. So I was at the NHS Hack Day in Manchester recently, and our team had a student from Cambridge, had a UX designer from Manchester. We came up with an AI-driven chatbot for medical education where I'd say, teach me cardiology, and it would ask me cardiology questions through that programming. So lots of new stuff in the landscape. So my project was through my MBA at Anglia Ruskin, and of course Anglia Ruskin is the largest medtech campus in Europe, led by Professor Tony Young, who's the Director of Innovation at NHS England. So my first goal was to do literature review. So that there is quite established literature in terms of placements, the timing of placements, the duration of placements. A lot of US literature looking at integrated placements, looking at the impact of that in terms of retention, but also skills development. So work I did at King's in 2015 was on collecting data on the timing and format of electives. And from that data, we gathered that most electives either happen at the end of fourth year, between July and September, or during final year, between January and March or April. Now with the onset of the UKMLA, which will come in 2022, it might make sense for medical schools to have a look at that data, and actually if the UKMLA is going to be set in January, would you want your students to be on elective for 3 months prior to January in the lead up to finals? But the good news is that every medical school now offers an earlier finals than June, which means if students fail their exams, then they don't need to repeat the year, as was the case for so many years. So my interviews I conducted were with academics, students, foundation trainees, specialty trainees and experienced clinicians. Really glad to have Helen's support, because Helen's experience on the ground and actually setting up these schemes was invaluable to our research. And the data was collected by Google and social media. So we've got a preliminary report that we'll be sending out through Famida through the MSc. It's around 90 pages long, but we'll produce an executive summary. But the report abstract is on your tables, and what we'd like you to do is, there's an A3 sheet. If you've got any comments or thoughts about this topic, please do write them down, and please write your name and your email address underneath your points, so then we can make contact with you. Because we're looking to release this in next year, and we'd really like your views, because we've got such a great demographic here from across the UK. So looking at case studies and how do we go about, so now we've got portfolios, obviously in foundation year, and medical schools have portfolios. Are expected to reflect, expected to keep a diary. But looking at the times, I mean, just out of interest, how many medical schools here encourage students to write a blog on their elective? Around 2, 3? Great. Which schools are they?
Well, we first encourage people that have them.
Okay, great.
Imperial College.
Imperial, great. And anyone encouraging want to do a video diary? A vlog?
No, essentially.
Imperial? Great, right? I think if we're to engage students today, so like me and the students here, I'm sure we'd much prefer blogging about it on social media. We aren't going to be taking pictures of lumbar punctures and putting them on Twitter and Instagram, which is obviously a fair, and I think it's really important that we have those briefing sessions before electives to show what is a good elective, show the case studies as well in which students have got into problems because they've taken pictures of patients in other countries, because sometimes when you're in another country it might seem that you're in a different environment, but in reality we're operating to the same codes and standards that we'd expect anyone here in the UK would be. But we have a number of students now who have come together to create a portal called planmyelective.com, and that portal will be a free resource that will be supported by partners such as HEE and medical schools. We will encourage our students to use this portal as the impartial advice portal, but also our students can publish their blogs, and then other students can learn from those experiences. So the Grand Round was something that we held at King's College in last year, and since we've had 3 more. And the first one was held at the Gordon Museum, and it was the first Grand Round that actually left a classroom, where we probably got thousands happening every week. We live streamed this on Twitter and Facebook, and we had a hashtag ICGR1, and we presented a case which was led by the King's Undergraduate Medical Education Community faculty on a potential stroke presentation. So we had students from Stanford University, from All India Institute of Medical Sciences in Delhi, all the way from Newcastle to Manchester, all live tweeting in this conversation about how they'd manage this case. And there's some really excellent examples of Twitter final cases that happen every week, where F1s and F2s run social media education. So it's just one way in which medical education and education in general is changing from being classroom lecture-based to open MOOCs and free online education. So we had the support from the editor of the Student BMJ, who was here earlier during lunch, Matt Billingsley, and he helped co-host this. So case studies, through our preliminary work, we've mainly spoken to UK students and doctors, but we have identified sources out there that do exist. So Electives.net, I'm sure many of you will be familiar with, is a not-for-profit organisation that is supported by the MDU. But there are many excellent university resources. For example, the King's Abstract System, which has 10 years or more worth of data and reviews where students rate the quality of the placement, the costs involved. But moving towards a national, global or national kind of platform which HE could support, having a free, up-to-date resource for students to look to, which would incorporate the fantastic work by the Medical Schools Council, by the BMA, ethical electives, and by stakeholders. And I was on Twitter earlier and I saw a free open MOOC which is being provided by a university for electives. It was really good to see that, because the benefit of these open MOOCs is that students can do them whenever they want. There's not a set window that you have to do, then it's always going to be there. So we are working on that in terms of the online portal, and we'll be sharing updates as we go along. So in terms of next steps, we'd really like all your views, particularly the students that come here and taking a day off clinics to be here. We really want to learn from your elective experiences. We want to learn from faculty and academics in terms of how you would envision a resource to look like, how could we all work together. So please do know more. And I'll let Helen translate the last slide.
Oh, and here's a bit of a cheery for you. That's the language of the north of Uganda. And Afoya Matek means thank you very much.